Breast care navigation at Community is a lot like sailing. Navigators have to read the wind without seeing the wind. I told my dad I found a lump in my breast, and he said, let's get treatment at Community Health Network.
The Breast Care Navigator will follow the patient and their family through the continuum of care. We're that constant caregiver. We're there as a coordinator, an educator, somebody that will reinforce what the physicians are saying. The patients love having a single point of contact. As a navigator, I don't have to be the expert on everything, but I do have to know who the expert is in case the patient or family has a question and I can't answer it.
And I thought it was a great program. I said, why not have an additional person on my team while I go through this journey?
When we introduce ourselves to the patient, the families are usually there, and we assure them that we're there for them just as much as we are for the patient.
I remember she was there the first day of treatment. She was there for me 100%. The navigator helped me by telling me what I should be expecting when it came to those chemotherapy side effects, such as losing your hair, the fatigue, and when they would possibly set in. I was a very active person before I started treatment. I was doing CrossFit 5 times a week. My nurse navigator was always there whenever I needed her, so she would be the person that I called before I would call anybody else.
They have so many specialists involved in their care, they're not sure who they need to call, and we tell them it's never wrong to call the navigator.
Say I wasn't feeling very well one day or I needed an appointment change, she would be the one that I would call.
Navigation started with breast cancer patients. We now have a GI colorectal navigator, we have GYN, we have head, neck, and lung navigators. I'm hoping in the future that we'll have general navigators so that every patient will have access to a navigator.
My mom used her to talk all the time just because she didn't understand. I could imagine what it's like being a mother, having a child going through this.
We're there to help make sure that the patient's plan of care is executed, that nothing falls through the cracks, that the patient is getting the best care that they can get.
I'm cancer-free, I'm in remission. It's fun to be back. So Community Health Network helped make my treatment very simple by telling me what the game plan was from the beginning. Going through cancer treatment alone, it's not something that you want to do. You need the biggest support system that you can when you're going through this journey, and to know that you have one other person there who can help you through it, and not only you but also your caregivers, is definitely something that is amazing.